Hello everyone, and welcome. Today, we're discussing a serious and urgent topic: coronary artery disease, CAD, the leading cause of death for men and women in North America. According to the Centers for Disease Control and Prevention, CDC, heart disease accounts for approximately 1 in 4 deaths in the United States annually, with similar statistics in Canada. CAD specifically claims hundreds of thousands of lives each year, making it the #1 killer in these regions. In this teaching, we'll explore what CAD is, why it's so prevalent, the risk factors contributing to its rise, and, most importantly, what we can do to prevent it. Backed by the latest research and guidelines, this session will provide actionable insights to help you understand and combat this deadly condition. What is coronary artery disease, CAD? Coronary artery disease is a condition where the arteries that supply blood to the heart muscle become narrowed or blocked due to a buildup of plaque. This plaque, made up of cholesterol, fatty deposits, calcium, and other substances, forms along the artery walls in a process known as atherosclerosis. How CAD develops: reduced blood flow. As plaque builds up, the arteries narrow, reducing the flow of oxygen-rich blood to the heart muscle. This can lead to chest pain, known as angina, especially during physical exertion or stress. Heart attack. In severe cases, plaque can rupture, causing a blood clot to form, which can completely block the artery and result in a myocardial infarction, heart attack. CAD develops silently over decades, often showing symptoms only when the condition has significantly progressed, making early detection and prevention critical. Why is CAD the leading cause of death? Prevalence of risk factors. North America has some of the highest rates of CAD due to the prevalence of lifestyle-related and genetic risk factors, including 1. High cholesterol. Elevated levels of LDL, bad cholesterol, contribute to plaque formation. 2. Hypertension. High blood pressure damages artery walls, making them more prone to plaque buildup. 3. Smoking. Tobacco use accelerates atherosclerosis and reduces oxygen supply to the heart. 4. Obesity and sedentary lifestyle. A study published in The Lancet found that physical inactivity and obesity are major contributors to CAD risk. 5. Type 2 diabetes. Diabetes increases the risk of CAD by promoting inflammation and plaque formation. Aging population. As life expectancy increases, so does the incidence of CAD. Aging causes arteries to stiffen, making them more susceptible to damage and plaque buildup. Lack of awareness. A significant number of people remain unaware of their risk factors, such as high blood pressure or elevated cholesterol. According to the Journal of the American Heart Association, up to 50% of heart attacks occur in individuals without prior symptoms, highlighting the silent nature of CAD. The impact of CAD. Individual health. Physical limitations. CAD can cause chronic chest pain, fatigue, and shortness of breath, severely limiting quality of life. Emotional impact. Living with CAD often leads to anxiety and depression due to the fear of heart attack or death. Economic costs. CAD places a massive economic burden on healthcare systems. The CDC estimates that heart disease costs the U.S. economy over $200 billion annually in healthcare services, medications, and lost productivity. Risk factors for CAD. Modifiable risk factors. 1. Diet. Diets high in saturated fats, trans fats, and refined sugars increase cholesterol levels and promote plaque formation. 2. Physical inactivity. Regular exercise strengthens the heart and improves blood flow. 3. Smoking. Tobacco damages artery walls and reduces HDL, good cholesterol. 4. Stress. Chronic stress raises blood pressure and promotes inflammatory responses. Non-modifiable risk factors. 1. Age. Risk increases with age, particularly after 45 for men and 55 for women. 2. Family history. A history of heart disease in close relatives increases risk. 3. Ethnicity. Some populations, such as South Asians and African Americans, have higher susceptibility to CAD. Preventing CAD. Evidence-based strategies. The good news is that up to 80% of CAD cases are preventable with lifestyle modifications and early intervention. Here's what you can do. Adopt a heart-healthy diet. Focus on whole foods. The Mediterranean diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, has been shown to reduce the risk of CAD by 30%, according to research in the New England Journal of Medicine. Reduce salt and sugar. Lowering sodium intake helps control blood pressure, while cutting added sugars reduces inflammation and weight gain. Stay physically active. Engage in at least 150 minutes of moderate aerobic activity per week, as recommended by the American Heart Association. Activities like walking, swimming, and cycling improve heart health by lowering blood pressure and improving cholesterol profiles. Quit smoking. 1. Quitting smoking is one of the most impactful steps you can take to lower CAD risk. Within a year of quitting, the risk of CAD drops by 50%, according to the Surgeon General's report on smoking. Manage stress. Practice stress-reducing techniques like meditation, yoga, or deep breathing exercises. A study in The Lancet found that stress management reduces CAD risk by improving heart rate variability and reducing cortisol levels. Monitor key health metrics. Blood pressure. Aim for levels below 120/80ths of a millimeter of mercury. Cholesterol. Maintain LDL levels below 100 mg per deciliter and HDL levels above 60 mg per deciliter. 3. Blood sugar. Keep fasting glucose below 100 mg per deciliter to reduce diabetes-related risks. Medications and interventions. In some cases, medications like statins, ACE inhibitors, or aspirin may be prescribed to manage risk factors. Consult your healthcare provider for personalized advice. The role of regular screening. Early detection of CAD can save lives. Screening tools like lipid panels to monitor cholesterol, electrocardiograms, ECGs, to assess heart function, coronary calcium scans to detect plaque buildup. These tests can identify risk factors or early signs of CAD, allowing for timely intervention. Coronary artery disease is a significant health challenge, but it's also one of the most preventable chronic conditions with the right lifestyle changes and medical care. By adopting a heart-healthy diet, staying active, managing stress, and being vigilant about regular checkups, we can significantly reduce the burden of CAD in North America. Thank you for joining today's session. I hope this teaching inspires you to take proactive steps to protect your heart health and encourage others to do the same. Let's work together to combat this #1 killer and pave the way for healthier lives. Stay healthy, and see you next time on Pulse Check.